the week before the period was due, I'd be in chronic pain, and it would start with the pelvic, the lower back. It would then go up to the upper stomach on the right quadrant side, so just under here, which then went up into the right shoulder. And then I would have my bleed. And then after the bleed, I would still have the pains, and it would come down as if it was in slow motion, if you like. It would be, that's easing off, that's easing off. The pelvis is easing off. Or I can feel my legs again, you know, it was just constant. And it got to the point where these pains weren't just coming when it was the time of the month. These pains were there every day. These pains were there every day of the month. And it just wasn't fair. I then went on to have the surgery to treat this endometriosis, and it was hard, it was tough. I went in with the gynae consultant, I had a thorax consultant. The thorax consultant had never worked on a case like mine. He went in and said, I will help you and do what I can for you. And I'm I will be forever grateful for what he did for me. You know, I went in, I was under the knife for 7.5 hours. You know, went in not really knowing what to expect. And then when I came round and they told me, yes, you definitely had diaphragmatic endo. You had lesions attached to the back of the liver from the back of the diaphragm. And it took a good going to get it out. You know, they even think that could have been there for many more years than what I've experienced the pain from. So during the surgery was well, it went well. I did develop a hemothorax, which is a partially collapsed lung to the area where they were working. They did suggest, they did mention the possibility of having to have the chest tubes, the drain tubes, in the case of this, but I was able to get around not having to have that. But the pain that I experienced when I woke up was pain like no other. It was, I couldn't breathe. I just couldn't catch my breath. The nurses, bless them, they tried so hard to help me with what they would call the cough cushion. But that for me, it didn't work. And I did get sent round to X-ray again to have another look at the chest. And yes, it was still partially collapsed, but I had to deal with that pain. There were talks about having to put that tube in and draining that. But for me, I said, I will try and fight through it. And I did, and I suffered for 3 weeks in pain. But I feel that that pain was really worth it, because I'm not in the extent of pain from the endo that I was in before having that surgery. If you feel that there is something you're concerned about that doesn't sit right with you, just make sure you go and take that to your GP and tell them. It can happen. It happened to me, it could happen to anybody else. When I was first diagnosed, I hadn't really looked into endometriosis because I felt silenced. I felt alone, I felt scared, didn't know who to talk to. This big long word, endometriosis, what is this? And you tell people and they're like, don't know what that is. But it shouldn't be like that.
It got really bad when I was probably about 17, 18. I was on really strong painkillers like codeine, tramadol. The bleeding was horrendous. I wouldn't be able to leave the house for about a week at a time, and the pain was just ridiculous. My mum's a nurse and she was just like, I've never seen pain like this. I've also previously had 2 ovarian endometriomas burst, which was extremely painful, and that's possibly what's caused the adhesion from that scar tissue. I'm kind of waiting for the next steps to see what they want to do with the ovary. I don't know if it will need removing or not, or surgery. Obviously, if it will, either of those options, that will affect my fertility. No one's actually spoke to me about fertility other than after my second surgery when I was 21 or 22. I I literally sat down with the consultant. He showed me the scans. He showed me that my uterus was a round shape instead of a flat shape, which indicated adenomyosis. And his words were, the only thing we can do is give you a hysterectomy. There's no other treatment we can offer you. Do you want it? I was given 30 seconds, this was under the NHS, to decide if I wanted it or not. I said no because I was so young, I didn't want to go through such a major surgery. And now I'm really grateful that I did say that, because at the time I never felt like I wanted children. And now it's something that I most likely do want. So I'm really glad I made that decision. But that could have been the case. I could have had my womb removed and a full hysterectomy at the age of 22. So I don't know where I'm at the moment, fertility-wise, especially with these issues with my left ovary. I'm not sure the state of my right ovary either, because I get a lot of pain there. No one spoke to me about egg preservation or egg freezing, which is something, especially if they'd mentioned it a few years ago before my left ovary had all these issues, that's something I definitely would have utilised and would have liked to have known more information about to be able to utilise that, because from the state of this ovary now, I feel like it's too late, which obviously decreases my fertility by 50%. So now I'm reliant on the right ovary. So I wish that would have been an option available to me, or even if it was something that could have been discussed. But unfortunately, it never was.
And the ultrasound just kept coming back clear. I think I went through that 3 or 4 times and there was just no progression, and the GP just kept dismissing me. One of the things that he would say, like quite a few of them would say actually, was it was common for women to have heavy periods. It was common for like my ethnic background. It was common for someone my age. And I just never really got anywhere with that. So I think naturally you just kind of park yourself and don't think anything of it. You think, oh, you're trusting this person, so whatever they say must be true. I remember at one point I used to work in a prison and having really bad bowel symptoms to the point where I kind of fainted on landings, and I would faint in my car, and I think like I'd be having a car crash or I'd lose my job and not know where or what was happening to me at the time. My symptoms went from having really heavy periods to then really bad bowel pains and not being able to digest my food, or it was digesting too quickly. I spent countless times not wanting to go out, or having the anxiety of going out, not knowing if there was a toilet nearby. And I'd never experienced any bowel pains before, so it was all kind of new to me. So when taking those symptoms to the doctors, I think I went through like endoscopies, colonoscopies, stool tests, urine tests, every test you can imagine apart from anything to diagnose endometriosis. And then everything came back clear. Even the GP said all my stool tests were fine. They could see high markers, but they said I was fine, and they kind of just left me to go about my business without any like further referral. I remember having a day full of scans, seeing the consultant, seeing the nurse, seeing the consultant again, and that's when they told me I had deep infiltrating endometriosis. I'd need a minimum of 2 surgeries. They said they could see my organs stuck together, so I think my ovaries, my bowel, my uterus, cervix, everything was stuck together with the endometriosis and pulled back. Thinking about my reversal as well, even with COVID made the waiting list, I think 3 years at the moment, so not knowing when that's going to happen. There's so many unknowns, and then let alone having to think about your fertility as you get older, and like I was saying about freezing my eggs and yeah, that kind of stuff. And just going to a clinic, I think you'd have to pay for an appointment just to get an appointment to speak with somebody about freezing your eggs. And none of that treatment or anything along those lines was available to me when I was going through that process.
Yeah, it was hard to get people to believe kind of the severity of the pain that you were living with. The doctors more so, they were not great. They would just send you on your merry way and just kind of just give you painkillers to manage it, or tell you to take fertility, contraceptive pills, that kind of thing to manage it. And they were very dismissive of it, to be honest. There was this one day I remember very vividly, was actually at work, and I needed to go to the toilet maybe 13, 14 times. And just the pain that comes with it is so intense. You just physically can't move from the spot, and it's just horrific. That's for me probably one of the worst things. I do worry that I might not be able to have children. I mean, I'm getting a bit older, not that that makes any difference, but I do worry with the severity of how bad it has been and how damaged my insides are where they've all been fused together. I do worry that it might be a lot harder for me, but like I said, at the moment, I'm kind of not at that stage in my life where I'm wanting to have children, but I do worry about it. I just wish I'd known what the symptoms were early on. I mean, we're 10, maybe 8-10 years down the line now, and a lot of this could have been resolved before if I had known that what I was experiencing for all those years wasn't normal. I think for a lot of people out there that are sort of on the journey, I think just to have more stuff being made aware to them, I think would massively help people. I think it's such a great platform for people to get in touch with other people, and the advice and the support that you give, I think, has been a breath of fresh air. It really has. It's been really, really nice.
So I got ready for my surgery date, and then they carried out the op. And throughout that, I remember sort of the build-up feeling quite nervous, but just hoping that that's what they'd find. And then I woke up and I was told that I had stage 4 endometriosis. The consultant was shocked because in his mind, I guess, he always said that I appeared too sort of young and my symptoms didn't necessarily match what someone should be experiencing with it. So when I was initially diagnosed with PCOS, this was before we knew that I had my endometriosis. I was initially told, age 11, that I'd never be able to have children, would be infertile, and that potentially if the opportunity come that I could get pregnant, it might help or fix it, but also the likelihood of that kind of going successfully wouldn't necessarily happen. Yeah, one day it will pan out how I hope it is meant to, but each day it's hard seeing bits and seeing other people experience things that you want so badly.
I got told by that doctor not to be so stupid, and I was only 16 and it couldn't be endometriosis. And I was told I was being dramatic and it was just a bad period. So that put me off ever going back at all. So I didn't, and I was trying to manage it with over-the-counter medication. But I was told by my consultant that saw me in 2019 that and he already knew that I'd had 2 miscarriages at that point. And he turned around to me and said, you know how to solve your endometriosis, or you know how to cure your endometriosis, is to get pregnant, have a baby, start a family, and that will get rid of your endometriosis. Yes, I wish I'd known how much it can affect your fertility, because I didn't know that. I just thought it was painful and could affect your cycles. I didn't appreciate how much it can affect your fertility. And if I'd known that back when I was 16 trying to get help, I think I would have fought a lot harder, and I think I would have tried maybe having children earlier than what I did. Because I think if I got help earlier, it may not have grown as much, it may not have been that bad, and it may not have affected my fertility as much as it has done. So the Endometriosis Foundation has really helped me. It's just a lovely community of people that are going through similar journeys to mine, and knowing their journey and just hearing other people's stories has actually really helped me, because it just makes me aware that I'm not alone. There are other people going through it as well, and that's been the biggest help. Is getting to know people and talking to people.
So I was 7 years old, nearly 8 when my first period came. Even before then, around once a month, I was fainting, being sick, in extraordinary pain. But we just thought it was normal. We just thought I was a young girl, incapable of handling a period because I was a baby still. And then we just kind of pushed through. And then when I turned 15, the pain became daily and I was in daily agonising pain. I ended up getting diagnosed with endometriosis at 16 years old after having surgery. I found it so difficult getting people to believe my pain. My doctors just fobbed me off. They used my mental health as reasons why I was going through this tremendous amount of pain.
Friends didn't believe me, school teachers didn't believe me. They said I had emotional problems. Family didn't believe me. The only person that I can say hand on heart never doubted me was my mum. I don't think I'll ever have the big family that I wanted anyway. I'm happy with just Elizabeth Hope if that's how it's meant to be, but ideally I would like maybe 1 or 2 more in the very distant future, but I know it's maybe not as likely as what it should be. There was no advice about fertility. They just wanted to push the pill on me or the coil, and I knew that I didn't want to do that. But there was nothing. It was just you have endometriosis, good luck in the future, having kids kind of thing. The Endometriosis Foundation, if I'd have had that when I was going through my diagnosis, I think I'd have been mentally better. I felt so alone. If I'd have had the Endometriosis Foundation back then, I think it'd have saved my mental health. No 16-year-old should be worried about their future fertility, and no woman should be worried about not being able to have children.
So that was, from the age of 11, maybe 10 to 23, I just dealt with this. I've dealt with the pain, dealt with the leaking, the heavy bleeding, and the mental effect as well. The mental effect was a lot because here's me thinking it's normal, and then I get this sudden diagnosis of a condition I've never heard of. It just blew my mind because, well, I didn't have a clue. So I had the surgery in 2019. Everything went okay, but I did have my worries, of course, because they're dealing with an endometrioma that was on my right ovary, that was attached to my right ovary. I had fears of something going wrong and them having to remove the ovary, and then that's less chance of me having children. I was worried about being infertile. I was worried about it all. But again, I was young, and so I didn't know if I was ready for children, but it does put a lot of things into perspective all in that brief moment. You think of everything. So again, I was very conflicted. I didn't know what to think, because one minute he's saying the coil would be great to help mask or help the symptoms of endometriosis and, slow the process of it coming back. But in the next breath he was saying, at your age, maybe consider having a baby, and I hadn't thought of that. Of course I've thought I've always wanted children. And then when I had the surgery, I also worried, what if something went wrong and I couldn't have children? But at that time, I just felt it was very unhelpful, his advice. I'm due to see him in December to discuss my future, whether that includes more surgery or the potential of maybe having to try for children. But there's always still that doubt of not being able to have children. Of course, there's the option of having fertility treatments, but that comes at a price and it's very costly. And with the pain and the not knowing and the hospital appointments and possible more surgeries, working to afford that seems almost impossible. And having access to these treatments such as IVF and egg freezing can change people's lives. It would certainly change my life. Although it's not guaranteed, it's the opportunity to be a mother, to love a child and to have a family.
The pain was the main symptom, which I only got during my periods, which is why I kept being told it probably wasn't endometriosis, because it wasn't continuing outside of my periods. But post-surgery, I was given a stoma, and I had to learn how to self-catheterise because my bladder was also damaged as a result of the surgery as well. But also one of the most difficult symptoms was the sort of mental health aspect, and actually just not knowing what was wrong with you, and knowing that something was wrong but actually being told that nothing was. So that was really difficult to deal with. So I was referred to a therapist for hypochondria before I was actually referred to a gynaecologist for investigation of my pain symptoms, which tells us everything we need to know about how seriously endometriosis and other menstrual health conditions are taken. Once you are put in front of somebody who is a specialist, who you trust, I've got very lucky to have a brilliant surgeon, a brilliant endometriosis team who really specialise in what they do, and I've now had fertility conversations with them, and they've really reassured me that there are options available to me that will help me to go on to have a family, which I'd really like. Obviously with endometriosis, fertility issues are really common, but I feel like knowledge is power, and so once I was sort of able to discuss those options with a specialist, I felt a lot more in control of the decisions that I could make about my fertility for the future. So when I was first told that I had endometriosis, actually the clinician at the time had said to me, so you have got endometriosis, it is stage 4, it does look really bad and we'll need an operation. And then actually followed that sentence by saying, but don't worry because IVF rates are really successful. So when I was diagnosed and I was told that I would need surgery, I was told that I would need a stoma, so I was able to mentally prepare myself for that. I was also told that there was a chance that my bladder would be damaged and I would need to learn intermittent self-catheterisation. So I was experiencing symptoms of endometriosis for about 9 years before my diagnosis, and my main symptoms were severe pain during my period. Later on, I was passing blood in my stools. I hadn't realised at the time, but actually the endometriosis had got into my bowel. And the pain was concentrated around my stomach, my back, and the backs of my legs. But I only got the pain during my periods. I didn't get it outside of my periods. And the reason I think that's important is because I hear a lot that if the pain stops when you stopped having your period, then you definitely don't have endometriosis. Yeah, so I think that organisations like the Endometriosis Foundation are extremely valuable. Like I said, knowledge is power, and being able to have conversations with people who are going through the same experiences as you, or maybe have been diagnosed and you haven't quite yet been diagnosed, but you know something's wrong. It's just nice to have that support, and nice to have someone to talk to who knows exactly how you feel, and just generally giving a voice to all of those who may not have that themselves, or have the courage to, or might not have the same access to certain treatments or support. This is why these charitable organisations are brilliant.
I remember seeing the first gynaecologist and I literally left the room crying, purely for the fact that I felt like I just wasn't listened to. I was feeling slightly set back with sort of achieving any diagnosis, and in fact I didn't really know, a diagnosis wasn't even really what I wanted. I just wanted my symptoms relieved at this point. I didn't really care what it was or what I had, I just wanted it gone. All of my tests, so my ultrasounds that I had done, I'd had multiple ultrasounds done over the years at this point, and they would always come back clear. My colonoscopies, bar the biopsy, would always come back clear. I'd even had an MRI at this point and that was clear. So I just really felt like, what if I actually just was really unfortunate and had painful periods and these random symptoms that I just sort of had to accept in life. Surgery is quite a big deal, and I didn't want to just have surgery and then find out that nothing was wrong, because then what do? You just have to accept that that's it. But at the same time, I think deep down I probably did know that something was really wrong and that it's not normal to be in this much pain. I saw a specialist and he actually did a scan and said that he could see a few different things, which I found particularly strange because all my previous scans showed nothing, and he sort of mentioned that he had quite high-tech equipment. So I suppose that maybe it was just that the hospital near me maybe didn't have the updated equipment. I think the turning point for me was that the specialist identified and sympathised with my symptoms, and he said that he's heard it all 1,000 times from all of his patients, and that exactly what I was explaining was just sort of tick box endometriosis. Obviously it can't be guaranteed that he'd find it, but he was willing to do the surgery, which I was relieved about, because I had heard many young women say that their specialists had suggested the artificial menopause, which for me, I really did not feel comfortable putting my body through that. So I was pleasantly surprised that he didn't mention that as an option. So I think in hindsight for me, it was that for so many years, I suppose the initial gaslighting from those few general gynecologists I saw, who told me it was sort of more of a me problem rather than a health problem. And yeah, I suppose I just felt frustrated at the situation, because the impacts of endometriosis can be shocking and devastating for many people. So I think, had I have left my endometriosis because I didn't want children, or I hadn't put on enough weight, or whatever it was, I don't know where things like my fertility would be like today. Because it can only be really seen in surgery, it's a struggle to know if things like your fertility are okay, because 2 years ago I know they were fine because my surgeon checked during surgery, but now I don't know if they are. I do suffer with some symptoms again, but not enough to go and have surgery. So what do? It's hard to know the answer. At this point in my life, I don't know much about fertility and things like that. I suppose there's not much education about it in general. So if I did want to preserve my eggs or see a specialist, it would sort of, I just don't know what I'd even begin with talking about, to be honest. So I think education and awareness in this area does need to increase. I think accessibility as well. There's no signposting to suggest who you would even go and speak to. Is this something that you should talk to your doctor about? It's not a current health concern of mine, although it is mentally. Physically, I'm not infertile that I know of, so, but I could become.